Measles are very preventable, so why do we hear about this? I mean, I hear, I'm going, the measles?
Right.
Like, what century are we in? Right?
Right. I know, absolutely. And the reality is, it's a very simple answer. It's due to non-vaccinators.
So it's because someone does not get vaccinated and put others in harm's way?
Exactly. So basically, this specific area is very interesting because what they call it is a non-vaccinator pocket. This is actually an area in Washington where there are several families that refuse to vaccinate their children. And because of that, again, this is where the herd immunity, this is the opposite of herd immunity. Now that we have a few people that are vulnerable and able to contract the disease and spread it, this is how we have this massive outbreak.
And it's hard to handle that because if it's a neighbor or something, what do? You move?
Right.
You say, look, you're not vaccinating your children, I'm worried.
Right.
You know, it's a hard decision.
It is, and you send your kids to the same school, everybody goes to the same school, they're all together, and this is what happens.
My goodness, what exactly are they? I mean, it's just so ancient to me, define it to me. Look at this.
Measles is a virus that causes viral-like symptoms, cough, cold, coryza, and then spreads to a rash. Unfortunately, it can spread very quickly. It lives on surfaces for up to 2 to 3 hours after exposure. Wow. Therefore, it's very contagious.
And it's not just a rash. Let's show you some of the dangerous complications that measles can cause. Ear infection, lung infection.
Yes, absolutely, pneumonia. So ear infection that can lead to meningitis, lung infection, which can lead to pneumonia, complicated pneumonia, difficulty breathing due to inflammation of the upper airways and actually occlusion of the airway, diarrhea, and brain infection known as encephalopathy and death.
So obviously if measles surfaces, you got to go to the doctor immediately.
Of course, absolutely.
How is it treated, if I may ask?
Well, there's no known treatment for measles. It's actually a viral illness. There are some antivirals that have been shown to work, and vitamin A therapy right now is the only mainline therapy that's been shown to work. There's evidence supporting that it'll help keep symptoms at bay and bring you to a quicker recovery.